In this video, I'm going to try and share the challenges that I'm facing as a resident physiotherapist being internationally graduated. Hello everyone, welcome back to my channel. This is the part 2 video of my journey as a resident physiotherapist in Canada. I'm very happy with all the positive response that I'm getting, and that motivated me to record this video as part 2 series of my journey as a resident physiotherapist in Canada. So what happens when somebody just get their physiotherapy license in Canada? So in their way, they have 3 to 4 different kind of physiotherapy settings to start their career. Who wants to start in long-term care? So a physiotherapist working in a long-term care support every resident's physical health and well-being by assessing and diagnosing symptoms of pain and limited mobility caused by illness, injury, disability. Part of an assessment include looking at how well a resident can carry out their activities of daily living. Physiotherapists speak with residents about their unique goals for maintaining their independence and then create a rehabilitation plan. Physiotherapists meet with residents to work in improving their strength, balance, and range of motion. Then the next option is in-home or community physiotherapist, where the physio is going to different patients' house and treating them in the comfort of their home. Mostly patients who are learning to get in and out of the bed after recent trauma or acute injury or any surgery. Then they usually seek help by community physiotherapists. Then there is a hospital setting, which is again acute care of patient or outpatient department. And comes the most common setting, that is the clinical setting where I'm working. So I work in interdisciplinary or multidisciplinary clinic where there is chiro, massage, physio, osteopathy, different professional work under the same roof. Depending on different clinics, some have only physio or massage, some have only chiro and massage. If you're interested into a specific field like pediatric physiotherapy, women's health, that is pelvic physiotherapist, or neurological conditions, or cardiopulmonary physiotherapist, different like rehab is there, or vestibular physiotherapist, sports and athletic physiotherapist. There are different kind of field where you can work, and also look for different clinics. So there are special clinics that are like concussion clinics related to post MVA, like motor vehicle accident cases are seen there, or some clinics that are specific to geriatric population, where you will be seeing more of like replacements, hip or knee replacement kind of patients. So when you apply for different jobs, look if your interest is aligning with their clinic. I decided to join a multidisciplinary clinic where we see lots of patients under the MSK term, that is the orthopedic conditions. So why I started with a multidisciplinary clinic versus long-term care is I'm not sure if there will be a practical exam or any different kind of exam that's coming in my way, because I'm a resident physiotherapist, meaning I've just cleared the written component and waiting for the practical component to be established, or we have no clue what's coming. So if I'm working in long-term care, I won't be able to practice my skill as I can in a clinic where I will be seeing different variety of patients. So that's one thing you can keep in your mind, that try and get into a place where you can practice your skills, or you can learn with other physiotherapists working around you, or someone who can supervise you, or someone who can guide you. So I applied to a number of clinics and I got interviews from few of them. In all of them, the most common question was, targeting your interpersonal skills. So remember, you don't have to prove how good physiotherapist you are, because you already proved that by clearing your written exam, that is the PCE. Now people are looking or the employers mostly looking for a perfect fit for their clinic. So they don't only focus on the physiotherapy skills like assessing and treating, but a compassionate and kind team member with effective communication and time management skills. So as I mentioned earlier, you already proved that you know physiotherapy, but let me be honest and share my experience. So initially I found it difficult to connect with my patient. I was only focusing on the treatment part. In Canada, customer service matter most in any field, be it with physiotherapy or any other industry. Just don't walk into the clinic to get the treatment and exercises and they just go out. No, it's a different, or they look into a full experience of physiotherapy. What's happening when they are there, how people are talking to them, or they remember how you made them feel during the therapy. Most of the time you are the only one whom they met in person. How to connect or how to give a good experience to your patients related to physiotherapy. Practice active listening. I'm not saying we don't listen, but active listening is something more than just listening to them. This is the model of the treatment. What is your approach? Do you have like holistic approach, biopsychosocial, where you are taking their physical, mental, emotional well-being into consideration and you're treating the person as a whole? The other thing I do is I try and verbalize each and every step that I'm doing or I'm about to do, so that I can gain their verbal consent during the treatment. I try and find a common topic to talk about with patient. Let's say weather, or how was their weekend, any plans for the coming weekend, or any upcoming sports which they follow. A few points which I kept in mind when I was applying or during the interview or before joining any clinic. You can ask them different questions like will you be working alone, or will there be a physiotherapist working with you in the same facility? Will you be the only physio working at a time, or you will have a supervision or a supervisor in the same facility with you? Then how long will the appointments be? Sometimes the follow-up appointments are as short as 15 minutes per patient or up to 30 minutes, which is optimum. And the assessment times, will you be given 45 minutes for the assessment or 1 hour for the assessment and treatment? Those are the points that I would definitely ask and be clear before joining a particular clinic. What are the perks of joining their clinic versus other clinic, like any extended health benefits they offer, or any scholarship, or sometimes they do provide different courses, or they give you certain, they cover the cost of the course, like certain percentages if you're working in their clinic. Discuss about the employee versus independent contractor position. They both have different taxes involved with it. You can, which one works for you better than the other. If you're doing home care, ask them for any mileage incentive they will give you per mile or per kilometer. Remember to ask the pay cycle, not just the pay, like whether they will pay you monthly or bi-weekly, and when is your first expected pay, because sometimes you can get your pay after, let's say, 45 days of when you started. So it depends employer to employer. These are some of the points that I would definitely ask my employer before joining, so that you can be stress-free and you can try your best, or you can help your patients in best possible way. Alright guys, that's it for today. Wait for the part 3 of this video. I'm very excited to add a few more details and share my journey with you. Subscribe to my channel if you haven't yet so that you can get the notification when my 3rd video is up. Follow me on Instagram, DM me if you have any question, and mention in the comment how you're finding my videos, so that helps me make more videos. Thank you. Thanks for watching.